I imagine there can be many different interpretations of what talking to your child about things that matter entails.
You can talk to your kids about different things, obviously, like, basic, how's your day, very straightforward kind of things. But I think what really matters is you can really solidify what a child is feeling, understand what they're feeling and validate those feelings.
Hey you, welcome back to Trauma Camp for Teachers. I'm so excited to bring you this episode. As many of you know, I launched the Trauma Camp for Teachers podcast back in 2019. Early on, I was doing most of my own podcast episodes, and then I decided I really wanted to have interviewees on and have more of a dynamic conversation with people in real time. So the podcast started to involve more outside people coming in for conversations. And right around that time, I came across this journal article published in the National Library of Medicine, and it was titled Adverse Childhood Experiences and Protective Factors with School Engagement. Knowing that this was speaking directly to the audience I am serving through this podcast, I reached out to one of the co-authors on the article, Dr. Angelica Robles. She was kind enough to hop on a Zoom call with me, and we promptly recorded an entire podcast episode. We did so right around the time that I was hitting a stage of burnout that would ultimately make me place a major pause on the Trauma Camp for Teachers podcast. I had this really rich episode that I was sitting on and never published. And so I am bringing you that episode today, and I'm really excited to do so. Dr. Angelica Robles is a developmental pediatrician. She is the co-founder of Coreless Health, which is a platform to connect neurodivergent and disabled children, adults, and caregivers with highly specialized healthcare providers, therapies, and services. And she is a real practitioner in this field and had such a warmth in her energy, and I hope you can hear it in the podcast. But what we talk a lot about in this podcast is really noticing not just the adversity that children are encountering, but taking a lens on the protective factors as well and how to work those into our work with children and families. So I think hearing from her is going to be really helpful to you just in terms of how she is lensing certain work and how she approaches this work. So without further ado, here's my conversation with Dr. Angelica Robles.
Dr. Angelica Robles, welcome to the Trauma Camp for Teachers podcast. How the heck are you?
I'm doing great. Thank you for having me.
Oh, you're so welcome. I'm really excited to have you on this podcast. And before we dive into the meat and potatoes of what I brought you on here to talk about, which is your article, your journal article, I'd love you to introduce yourself to my listeners and who you are, what you do, and how you came to this work.
Yeah, so that's a long-winded answer.
We got time.
So I'm a pediatrician, but I specialize in developmental behavioral pediatrics. So a lot of people don't really know what that is. So what we do is we are the specialists that your general pediatrician would refer to whenever there's a question of developmental delay, behavioral concerns, learning issues, ADHD that might be complex, autism, a number of different things. And we see kids starting from when they're little, even if they're ICU, NICU babies with their developmental delays, all the way up until 18, up to 21 years old, even if kids are still in high school at that point. So we see a full range of kids in different points in their lives. And what I do is I really get a really detailed history. The nice thing about my visits is I have a lot more time to do that. So I have about an hour and a half for a new patient, which is a lot more than you get with your general pediatrician, which I really enjoy about that field too. So I get the full history, concerns, obviously, that the parents have, anyone else, detailed developmental history, behavioral concerns. I talk with the kid as well, kind of see what their point of view is from those concerns. I do some developmental screenings, see maybe with IQ screening or where they're at with their development, do some behavioral kind of screening things as well, a physical exam, and then I put it all together and try to put it into a package and what I think the diagnosis is and what the plan is from there. So that's a lot to do in an hour and a half. And sometimes you have to break it down or review things that have been done elsewhere, like school evaluations, or I like to get teacher reports and their input as well, which is really important. So there's a lot included within that hour and a half. And then I do follow up after that based on whatever our plan was, what that diagnosis was, if we do medication or therapy or whatever the recommendations are.
And so you're really working with a population that has been flagged as really struggling, potentially, I don't know if this is the language you hear for the families or the children coming in, but problematic, challenging.
Yes.
Right?
Yes. So usually when families meet me for the first time, they are already at the point where they don't even know what to do anymore, and they're just kind of at a loss. So I am definitely seeing a lot of these kids that have had a lot of trauma or their families have been through trauma. And that really led me during my fellowship training to have that interest in the research that I did do. Because a lot of the kids that we see, we definitely notice that they have had those experiences more so than those that haven't. So kids that have these adverse childhood experiences are definitely more at risk of having developmental delays and behavioral concerns, and that's what I deal with. So I see a lot of it. And then when I really talk to the families and get social history and all that, they usually feel pretty comfortable with me to tell me what their own traumatic experiences were. And so then you really see the connection with how that passes on from one generation to the next. And so that is something that I commonly see every day. And I really see the impact that that has.
That's really important and powerful, because I think it's kind of a revelation to a lot of folks who are not in the field that underlying these diagnoses are often complicated histories, and histories that include different levels of toxic stress and familial instability or community instability or intergenerational trauma. And it sounds as if, and you tell me if this is an accurate understanding, that a lot of the families you see have had trauma and it's kind of manifesting in the child, and it's often trauma that's never been addressed and never healed.
Exactly. And, the more that I see these families, the more I think about it from that perspective. And I think about, okay, what has happened to this parent or this family? And then I really see how those experiences have led to a lot of what we're dealing with in this time and point. So, it really affects all aspects of life. And then you really see where the family is now, that parent now, and thinking about everything they've been through and now what their own child is going through. And when I talk to them about a lot of these things, it really clicks with them too. And they identify that and understand that. And they obviously want to do whatever we can in order to help kind of stop that cycle and do the best for their child. And unfortunately, a lot of the times, because they have so much stress in their lives currently, maybe we're not able to do everything we can, but, they really do try their best.
Yeah, I think that sentiment and that kind of approach to this work is tremendously helpful to the child and their family in and of itself. I think something I've encountered, not just in my work with teachers, but also just kind of in society at large, is when the kid is demonstrating issues or delays or problems, there's this impulse to point a finger and blame. And I'm not immune from that as well, right? And I think we live in a culture where it's easy to sit like, what's going on here, rather than understanding that while families, while the chaos that they're experiencing, yeah, it surely probably is impacting their child, coming at it from a place of understanding that they're experiencing it too.
Right.
Which is really the difference between compassion or judgment, I think
Yep.
it comes down to.
That's true. Mm-hmm.
So how did you get into this work?
So I kind of stumbled upon it. So I always knew I wanted to work with kids, and I always had a love for medicine and science. And it's funny because I remember when I was getting interviewed for medical school, I wrote this personal statement that talked a lot about when I visited this orphanage and there were these kids and I really wanted to help them. And the doctor that interviewed me was like old school man, and he was like, well, are you sure you don't want to do social work instead? And I said, no, I really love medicine, and I still think I really want to do this and work with the kids too. And so I think a part of me has always wanted to connect medicine with that social part, and then going into pediatrics and working with these families and really enjoying time talking with and working through these things, I discovered developmental behavioral pediatrics. And then when I did that rotation, I just really felt that connection. I felt it was just right, and all these pieces fit together.
I actually think that story separated from medicine is a lot of reason, a lot of the driving force that teachers become educators. For that same I had this feeling that I wanted to help, and also in this particular way. And I'll just say, I'm so glad you found your way to this vein of medicine, because I think that's where huge change is happening now, is when people have they've not stayed in their own lane, right? And it's interesting that the advisor, the interviewer said, well, you sure you don't want to go to social work? As if that's separate from medicine,
Exactly.
right? And I think what's happening in terms of providing trauma-informed care across discipline is basically reaching across and being like, what are you finding in your field, and how's it applying to my field? Whether it's medicine or education or law enforcement or mental health.
Exactly. It's all connected.
Yeah. So, and that is not, I think now that we've gotten an introduction about you, I want to hear about your work. And I came across this newly published, I think it's pediatrics article that you did, that you were the lead author of. You had, I think, 4 other co-authors. And it was called Adverse Childhood Experiences and Protective Factors with School Engagement. So of course that piqued my interest, and I'm like, what do they have to say, right? And we hear so much about ACEs, at least I do, that I can often fall into the trap of thinking I know it all. Like, what else is there to learn, right? I've heard about ACEs and the 10 questions time and time again. But the 2 words, protective factors, I immediately heard that, and I was like, I need to talk to this woman. Read this article, then talk to this woman. And I want to know what led you to spearhead this vein of research.
So, like you said, adverse childhood experiences, that is such a hot topic right now. And I think in the last few years, at least the last few years, pediatricians in particular have really had a lot of interest in that area, because again, we see these families a lot, and we really get to know various children within that family, the parents, they trust us, and we build that relationship. So with that, there is more screening that is being done in a lot of pediatric primary care offices. But then the question is, we have this information and we know that these things are happening, but what it led to was then, well, what do we do with this information? Because we know these are affecting this family or this child, and then we feel tied because maybe there aren't services to provide this family with or this child with. And, as people that want to help others, it's frustrating, because then you feel like you can't do anything, and we want to help them. So then more so now, I think people are trying to identify what can we do when we get these results. And so trying to identify those protective factors to help mitigate the effects of those ACEs is really what I was more interested in doing that with. What do we do with that? And what positive things can we provide this child with in order to help it with those effects?
So it's kind of looking at not just what has happened harmfully to this kid, but are there any factors there that have helped them get through it and will help mitigate the long-term factors?
Right.
Right.
Exactly. And then what protective factors may they be missing that we can then kind of reinforce or try to talk more about or connect them with?
So what did you, tell me about the study and what you looked at and what were the results?
Yep. So the study was based on a national survey. So that included a lot of children within the entire country. It was a telephone interview, and this was around 2011 to 2012. And parents were asked various questions about development, behavior, education, all about one child in the household randomly selected. So it's all per caregiver report. But within that year, that was the first year that ACEs were identified and included in the survey. So this is an ongoing survey, but again, that was the first year it was implemented in that. And so that also limits the number of questions we can use within that research study, because we can only have the answers to those specific survey questions. So within that, we had those ACEs, and then I looked at, okay, I want to look at these protective factors, looking at the family, looking at the community. So I had to look through all of the questions, kind of see which ones I felt would probably be protective, and then look at those school factors. So how do I measure how the school outcomes or engagement would be? And so unfortunately, it doesn't really show us, report cards or that teacher input, but it does at least show the parent's perspective of, has the child been engaged in doing homework or show interest in school? Have they repeated a grade, to kind of be secondary measures of that school outcome, but just to kind of get an overall assessment of those various things. And so with those ACEs that were included, I broke those down into different categories. So similar to a lot of other studies, if the child had 0, 1, 2, 3, or 4 or more ACEs, and that's from 6 to 18 years old, so in that school age range. And then looking at those protective factors, which included 7 different factors in the family and the community. So those included, does the family eat 5 or more meals a week together? Is there smoking in the home? Can the parent and child talk about things that matter and share ideas? In the community, is it a safe neighborhood? Is there recreational library pathways? Is there that feeling of community where they can kind of count on their neighbors to take care of their child? And also how the neighborhood looks, is it tidy? Is there littering? Is there graffiti? And those kind of things. So with that, I categorized it into if the child had 3, 4, 5, 6, 7 protective factors. So kind of try to compare the same categorization with the ACEs. So I looked at those separately and then try to combine them to see, if after we did that separately and put them together, would it show a difference? Trying to see if those protective factors maybe have some effect on those school outcomes with the ACEs included. So again, you can't really say this was directly what led to the improvement, but overall you can kind of say that it was correlated with association and better outcomes. So looking at that, we really saw that as the number of ACEs increased, going from 0 all the way up to 4 or more ACEs, children were definitely more likely to have those negative school outcomes. And it was almost like a graded dose response. So they were definitely more likely to have all of those things occur.
What about children who had high ACEs but also had high protective factors?
So when you put those things together, it definitely showed that the negative outcomes were decreased compared to when it was just the ACEs. So when you put them together, it did seem to make an improvement in those things. So that was definitely something I was like, okay, I think we have something here.
Yes.
Yeah.
I love that, because I love that you created a body of data to support something that I think is, it seems obvious, right?
Right.
If you're
Right.
going through something hard and you have people around you to support you,
Right.
it's going to be easier. It's not going to take away the difficulty, but
Mm-hmm.
it's going to make that hardship less painful,
Exactly.
suffering, right?
And
Yeah.
I think intuitively we all think
Yeah.
that makes sense.
Yes.
But when you really see those numbers, it really confirms that. And I think within the scientific community, it's also really exciting because we like numbers and we like seeing those figures and those outcomes. But I will say what was most exciting was within all of those different protective factors, the one strongest protective factor was a parent and child having that relationship where they can talk about things and share ideas. That was the strongest one.
Can we dive into that a little bit? Like, what does that look like? I imagine there can be many different interpretations of what talking to your child about things that matter entails.
So I think, you can talk to your kids about different things, obviously, like, basic, how's your day, very straightforward kind of things. But I think what really matters is you can really solidify what a child is feeling, understand what they're feeling and validate those feelings. Those are real feelings. Those are good things for you to share with me, and not to take away from what they're feeling, but to just support them and say, I understand you're feeling that way. And then working on what they're feeling and trying to help identify those coping skills or what to do in that situation. But I really think it's more of the core of that, what they're struggling with, understanding, validating, and then making a plan for them, or just simply being there as support when they're feeling that way.
So it's really about having a, primary caregiver there who is at least in some way attuned to the inner experience of the child.
Right.
That's powerful stuff. I mean, as a therapist, I'm like, duh, but
right. Same for me.
Yeah, but at the same time, I don't want to say that this is a rare experience, but it's not as normal as people would expect. I mean, kids go from a variety of backgrounds. It's not just, what we assume to be traditionally, struggling communities. Like, you can be affluent, you can be poor, you can be educated, not educated. And the trend can often be a child growing up in a home or community environment where they don't feel seen, they don't feel heard, they don't feel understood, they don't feel like people care. And so it's interesting to hear that this is it's validating to hear that this is the most protective factor that you found.
Right. And I think what makes it hard for parents at times to also perhaps identify that in their child is if they have their own toxic stress or mental illness, then, if they're depressed or they can't really be the best parent, they're not going to have that opportunity to provide their child with that. And I really think that's something that we need to aim on addressing, along with many other things. But
how do you support those parents who you identify that there's some block or there's some inability for whatever reason to be communicating with their child in this way?
So I definitely talk to these parents if they're, as long as they're comfortable with me
Yeah.
about that. Identifying, if you are not in the best place for yourself, you cannot be the best parent for your child. And trying to understand that taking care of themselves is really important in the care of their child too. Because I think a lot of the times parents are busy, they feel guilty doing anything for themselves or time, whatever it is. So I really try to reinforce that they need to address what's going on with them, whether that be through counseling or taking time out just for themselves if they can, and then trying to come to terms with what is going on with their child and try to be that support for them and to have them understand, if you react in one way, it could escalate the child's behavior too, because they definitely feed off of that. Or they may be engaging in some things that are attention seeking because they're seeking that in the first place. So I really try to help them understand that perspective and that they need to do those things for themselves too.
So Dr. Robles, that's really powerful, because I think what often happens, and I'm sure you can attest to this, is that the child is the one who comes in for the services, and it's often the parents who, that experience is what gives them permission
Right.
to go and seek their own support.
Right.
Because the truth is, parents are going to have much more of an impact in the child's life than any provider will.
Right.
And so if these parents if they are feeling seen and heard and witnessed and acknowledged and understood, that suddenly becomes an experience that they have to offer their kid.
Definitely.
So what does this mean for teachers? How does this information apply to being an educator?
Absolutely. So that is definitely a piece that we were lacking in this study, and I think is really important because teachers, anyone else within the school, is at the front line with these kids and on a day-to-day basis, where they are the ones seeing these behaviors or having these concerns in development or learning. And so really it's important to get their perspective. And that's another reason, like I said, I really try to get their input by having the families give the teachers reports in all these different areas, just to kind of get where they're coming from. I obviously am not within the school, and every school is a little different in terms of what resources they have or what tools they have. But I think, again, for teachers, a lot of education now is becoming aware of ACEs and trauma, and like you said, they're more informed about this. So I think there's that general understanding more so now that, these children are not just a consequence of whatever the parents are doing or, simply ADHD or things like that. There's likely something else going on. And understanding, I think, is a good first step. And then, like you said, what do we do with this? So that is something I think I would definitely like some input from educators, because it's hard for me to know what they deal with and how we can help with that.
That's really fair, because I think with information like this, it doesn't necessarily solve a problem, but it points us in a direction where solutions can be found.
Right.
And what I really got while I was reading the study and thinking about, okay, how can this apply to teachers, is it made me think, at the very least, if you have a student who's engaging in one of the ways that you were looking at, if their school engagement is poor or dysfunctional in any of these ways, to pause and consider that they might have some ACEs. They might also have low protective factors.
Right.
And that in each of those categories, there might be things that the teacher can do to be working with the parents, to be, folding that kid in to more adult relationships within the school.
Right.
Right. Can we backtrack to the actual what you looked at? What were the 3 areas of school engagement that you were looking at?
So if the child had repeated a grade, if they seem to show interest in doing homework, and then just with overall interest in school.
Okay. Okay. I mean, I'm hearing that and I'm like, there are tons of teachers who are listening to this and they're like, yeah.
Right.
I have students who are unmotivated,
Yeah.
who, maybe they've repeated a grade or they just seem like they don't care, right?
Mm-hmm.
And so for all you teachers who are listening, I want you to consider this kid's background, right? Like one thing I like to tell to my clients, and I work with children as well as adults, is I say this more to the adults because the kids might not always understand, but but I'm like, if they're like inactive or not fulfilling their goals or what, they're stuck and they're frozen or engaged in really maladaptive behavior in some way.
Mm-hmm.
I often say to them, you didn't come out of the womb this way, right? So what happened to you that led you to seek this as a solution?
Right.
We have to consider that, right? And so when it comes to a kid who is unengaged, uninterested, repeating a grade, maybe behaving poorly, what's gone on in their life that makes this behavior or this way of engaging with school or life a solution for them?
Absolutely. And I like that you made the question in that way where you kind of separate it from it being something wrong with the person and what is the bad thing that happened to you, not that there's something wrong with you. It's what happened. And separating that, I think, also helps that person, whether it's an adult or even a child that's a little older, perhaps, see that separation so that they don't feel like something is wrong with them and see that as a negative thing about them. It's something that they can work on. So I think that's really important in that perspective.
Yeah, I think it's really, I love that because I think it's really dangerous if we're categorizing children as like bad or willfully defiant or.
So, by the way, ODD, I really don't like that diagnosis.
Tell us, okay, so this is oppositional defiant disorder.
Yeah.
So I want you to get on your soapbox for a second, and I just want you to know you're in good company.
Yeah. Absolutely. So I frequently get referrals for that diagnosis, even, for toddlers, which is a little ridiculous, but those children that are being, seen as really defiant, don't want to listen to authority, whatever that might be, a lot of the times there's something causing that. Kids are just not going to be defiant out of nowhere. Usually there is a trigger for that, whether that be adverse experiences or trauma, whether that be mood issues like anxiety, depression, a lot of the times, ADHD that's not well controlled. So usually there's something else that is the cause of those negative behaviors, not ODD. So I never diagnose that. And usually when you treat those other core issues or symptoms, that usually improves too. So just FYI, I think you can't just label a child as oppositional defiant. You have to look at other things too.
I think that is one of the more prevalent diagnoses that's known in schools and used in schools. It's usually ADHD, autism, ODD. Those are kind of the go-tos for a lot of teachers. And I'm gonna get on my soapbox for a second about diagnoses. The DSM has made a tremendous contribution to the field in a lot of ways, and it's an incomplete understanding of what's going on. It's a collection and categorization of symptomology without understanding root cause.
Exactly.
And like you just said, something that might cause a child to be defiant with an adult, oftentimes it can be due to relational violation of some sort, right? And so a kid goes into fight mode when they feel threatened. Other times it can be ADHD that's not well regulated or understood, and so they're just getting, again, going into fight mode, but it's because of a sense of chaos or, right, this hypervigilance to the surroundings. And so, I just want all you educators out there to understand, hearing from two professionals in the field, that while this is our official manual, it's also not, it's not the end of our understanding.
Right.
There's
Right.
much more to explore. Yeah.
Absolutely. Like you said, I think it really doesn't help us get a full picture at times. And it lacks understanding of that child and all of those experiences and things that are going on in their lives. We're missing a lot of that with those diagnoses.
And if we stop at the diagnosis, especially using the example of ODD, we can often be setting a kid up to continue experiencing, to continue to experience trauma. Like a lot of kids, I don't know exactly what the numbers are, but ODD is often correlated with experiencing abuse.
Yep, absolutely. And like you said, I think a lot of these kids probably lack trust the adult relationship. So that is because maybe something happened with a parent or another adult within their lives. So then they're probably going to be less likely to trust someone like a teacher or someone else that has that role in their lives. And perhaps, like you said, they're feeling like it's fight or fight. So if a teacher, tells them to do something or they take it in the wrong way, it could trigger something that has happened in their lives, and then they react.
Yes.
And so there are actual changes in the brain that happen when kids experience these traumas, where then they are going to go into that mode real quick as soon as anything like that happens.
And I love talking to you about this because it just deepens an understanding and like what's really going on. And I think the unfortunate truth for a lot of educators is that they're taught to understand behavior differently. Mm-hmm. They're taught to understand it as calculated and thought out and a reflection of what a kid believes, like a reflection of disrespect, or I love actually how you said attention seeking. Well, they might be seeking attention. That
right.
This behavior might be how they're getting their need for attention met.
Exactly.
And so it's offering a more comprehensive understanding how to work with these kids.
Right.
One of the thoughts too, and I know I want to be respectful of your time. One of the last thoughts I had in terms of how this can be applicable to teachers is, let's say a teacher has a relationship with a kid and they are building a relationship with the family, and they are really starting to understand that the parent has their own trauma or their own unresolved stuff that's making it difficult for that parent to be attuned to the inner experience of the child. And even if a teacher doesn't know this history of the parent, a teacher also gets to be a person who can talk about things that matter with a kid.
Yes. Mm-hmm.
And I still remember my teachers who asked me about my life, asked me about my feelings and who understood that it was important to explore that part of me. Absolutely. And it doesn't have to be the parent. And that's why I want teachers to feel empowered too.
Exactly. And I think that was something that the study lacked, is we didn't have that specific question just to say, other than the parent or caregiver, is there that other adult that can do those same things? And I really believe that as well. Unfortunately, if that isn't in the home, then they can definitely get it elsewhere with a relationship like that, with something that they trust and see day to day. And I think that can really make a positive impact on that child's life.
Yeah. And Dr. Robles, I mean, your first study was awesome. So who's to say this was your first one, right?
This was, so yeah.
So who's to say that there isn't a part two?
I would definitely love to work on a part two. So I'm actually thinking about how to move forward with that. And I think what I'm kind of struggling with is wanting to know how can we help the schools? How can we help the educators? And again, like I said, I'm not there. So it's hard for me to know that. And I don't want to do something that is not going to be relevant or helpful. And so I think that's where I would like to get some input. And I welcome anyone to email me with any ideas, because I truly want to know how can we help every day in that setting.
I so appreciate that. And I also want to acknowledge you for doing what I consider, I'm sure you find pleasure in research, but what I consider to be arduous, time consuming, granular work of actually doing a scientific examination and study, because it is findings like yours from this article that does give legitimacy to what a lot of us practitioners and educators in the world see and kind of intuitively know. And so it's really helping our field along. And I just appreciate you for doing that, and your team. Please pass along thanks to all of those other co-authors.
I will. And I really am happy to hear that it is helping all of you and whoever reads it, because that is the goal.
And so aside from those teachers who I'll have all of what we talked about in our show notes. And the article, again, Adverse Childhood Experiences and Protective Factors with School Engagement. I'll have a link there on my show notes. If any teachers are listening to this and they're like, yeah, I have some thoughts. I have some information I want to provide, or some questions I want to ask, or I'd love to connect with Dr. Robles after this interview, where can they find you?
So you can email me, like I said. It is V as in Victor, Robles 85@gmail.com. And I believe my email is also on that article, so they can find it there. And I definitely read my emails and reply pretty quickly, because I don't like anything in my inbox unaddressed. So I would probably get back to you fairly quickly, or at least let you know that's a great, helpful idea, and that I would include that in whatever I move forward with.
Well, Dr. Robles, thank you for your work. Thank you for your time. It was really good to have you on the show.
Thank you so much for having me, and thank you for the invite again. I appreciate it.
So that's it for the episode. Thank you again for joining me and Dr. Angelica Robles for this rich conversation about both adversity and protective factors. If you have some insights about the application of this work into school environments or into work with teachers, I would love it if you took her up on her offer and reached out to her. Her email will be provided on the show notes. She mentioned it in the episode, and we'll have it there for you. But I would really recommend you both reach out to her to share your insights or contribute however it feels right to do. But I would also like to ask that you copy me on that correspondence so that I can stay tuned as to what the conversation is unfolding around this area of how to apply not just knowledge of adversity, but protective factors into school environments and into teachers' work with students. So thank you so much, and I'll see you next time.